So good morning and welcome to the second part of our webinar series called Living with Ticks. This program is all about ticks and your beloved pets. My name is Lissa Radke and I'm the Community Development Educator at the UW-Madison's Division of Extension in the Ashland County office. This program is hosted by Ashland County Extension and the UW School of Veterinary Medicine in the Department of Medical Sciences in Madison. First, a bit of housekeeping. We are recording this presentation and we will post it in about 7 days on the Ashland County Extension website. You'll get a link to that website in a follow-up email that I'll send right after this program. You're welcome to type your questions or comments in the chat box as we go along, and we'll go through them as we talk with our speaker. I'll also be putting several links in the chat throughout the program, so you can find more information about this topic as we go. Before our speakers begin, I have a short anonymous poll that will take about a minute. It's just 4 questions. Your demographic information that you share with me will help me ensure that our programs reach diverse audiences as required by our federal funders and partners. So I'd appreciate it if you all would take just a moment to take this short poll. We'll take about 10 more seconds. Thanks very much for taking the poll with us. I'm just going to close it. So why are we bringing you this program this morning? Wisconsin is an epicenter of tick-borne diseases in the United States. We have the 5th highest number of cases of infections in humans and a significant number of cases in dogs and cats. Even horses and farm animals have been known to be sickened by a tick disease. So now that we've entered the prime time of the year for tick populations to emerge from their winter hibernations, we thought it was a good time to renew our understanding of what ticks are biting our beloved 4-legged friends and how we can prevent, diagnose, and treat infections. I'm delighted to bring our speaker today, Dr. Amy Nicholson. Dr. Nicholson is a doctor of veterinary medicine in canine and feline practice at the University of Wisconsin's School of Veterinary Medicine in the Department of Medical Sciences in Madison. She's a relative newcomer to Wisconsin, having moved here in 2020, and in her free time, she enjoys being outside in our wonderful state, birding, hiking, and exploring the state. She's currently a clinical assistant professor of primary care services, and she teaches vet students about how to care for canines and felines, including managing tick diseases. She's very busy with all of her work this summer, so I feel really lucky that she could join us today. Welcome, Dr. Nicholson.
Thank you so much. So I'm really excited to be here today to talk to you a little bit about tick-borne diseases and your pets. So I'm going to go ahead and see if I can figure out how to share my screen. Give me just a minute. It always seems easier when you're not. And what I'd like to do is have this be, I have some prepared slides, but then I'm sure that everybody has some questions. So kind of opening it up for some conversation as well to just make sure that everybody's thoughts are and questions are answered. And Alyssa, are you seeing the PowerPoint?
Not yet.
Okay, let me see if I'm doing that. How about now?
Yes, that's perfect.
Perfect. All right, so without further ado, so the main questions that people often have when they are looking at tick-borne diseases is where are they prevalent and what kind of ticks are prevalent in certain areas. So, so this kind of gives you a map. And I took this from the American Kennel Club Association, and they have a tick prevalence map looking at the different types of tick, and they got that from the CDC. And so in Wisconsin, you can see that the main ticks that we have to worry about are the brown dog tick, the American dog tick, and the deer tick, which we'll talk a little bit more about, but which is actually the black-legged tick. It's not a true deer tick, but it just has that kind of misnomer that we recognize, and so we kind of keep with that. And all of these ticks can transmit disease. So the most common tick-borne disease that I think we think about is Lyme disease because of its effect on humans and our pet population. And that's transmitted by the black-legged tick, or the deer tick, as we call it. Anaplasma can also be transmitted by the black-legged tick, although it can also be transmitted by the dog tick. And then the Lone Star tick can share anaplasma along with Ehrlichia and some Rocky Mountain spotted fever, but we don't tend to see Rocky Mountain spotted fever in this area. So the big three in Wisconsin are going to be Lyme disease, followed by Anaplasma, followed by Ehrlichia. But the reason that I like this diagram is you can see I have them kind of zoomed in here, and they're a little bit blurry as they're zoomed in, but just so you can see the ticks, and then you have the ruler on the side, and then I zoomed it out. So over here, you can see where it's actually 1 inch. And so these are how big the ticks are going to be in real life. And you can see that again on this finger here, the different stages. So larval, nymphal. It looks like I got muted.
Oh, I'm sorry, Amy. You're okay now.
Okay. Did you guys hear everything that I said, or do I need to recap anything?
You were talking about the larval stage.
Okay, perfect. Thank you. So the larval, the nymphal, and then the adults. So the different sexes are different sizes. And the reason that's important is you can see how tiny they are. And at this stage, they can start transmitting Lyme disease. They can start transmitting anaplasma. So you can, and I think that's the number one way that humans actually get Lyme disease is through nymphal bites, because we don't see them. So if you don't see them, how do you take them off? And so it's important when you're looking for ticks and you're scouring your pets to recognize that they can be quite small. In terms of areas that are going to be at risk for ticks, we're thinking high brushy areas, areas with lots of humidity, the right season, right? So another key factor is we typically think of ticks being more prevalent in the spring, summer, and fall, and that's true. But they can be active anytime that the ground is above freezing. So we can see tick activity if the ambient temperature is over 40 degrees Fahrenheit. And that becomes important when we look at whether or not we should be providing flea and tick prevention year round or seasonally. And so a lot of times we're going to recommend year-round prevention because of the concern that anytime, there's times in February we'll get over 40 degrees and your animals are at risk. So we do recommend year-round prevention. And then if you're having landscapes like this, can we cut back the brush? Can we create a tick-free zone to protect your animals? And the reason is that ticks love to do this questing behavior. So they'll go up onto the tallest branch or on the tallest shrub, and they'll just hang out there waiting for something to pass them, and then they just grab on and then they climb. So anything that provides altitude will increase tick exposure. And then if we look at prevalence, we say, okay, well, Lyme disease, Anaplasma, and Ehrlichia are the most common tick-borne diseases we see in Wisconsin. There's a really nice website that I can put in the chat. There we go. that you can look at your county. So I did Ashland County since that's the extension that we're presenting with today. But if you're not from Ashland County, you can take a look and say, okay, for these different diseases, what is the prevalence in my county out of the animals tested? And so this provides a really nice resource. You can also look for heartworm disease or other infectious diseases if you're interested. And so in Ashland County, you can see that the prevalence of Lyme disease in our 5%. Anaplasma is 4.4%, and Ehrlichia is 0.45%. So, and you can see kind of it's a heat map. So based on prevalence throughout Wisconsin, you can see kind of the prevalence of these diseases throughout Wisconsin. So if you're traveling, if you're, in Dane County and you travel up north a lot, that may influence how you prevent tick-borne infections and if you consider vaccinating and things like that. And we'll talk about that. So I think that's kind of a nice resource. And then tick prevention. Here we talk about the questing behavior again. You see our little tick ready to climb on. So if we can avoid high risk areas, we should. Certainly that's not always possible. We have these hunting dogs that go out into high brush, go running. If you live on acreage, that's not always possible to avoid high risk areas. But if you can create a tick-free zone, that can be helpful, cutting down shrubs and grass by the home, things like that. Always check your animal, even if they're on prevention, you should always check for ticks. If you're seeing them on you, you should check your animal. And removing them promptly can really help reduce the risk of infection. And there's a lot of different ways to remove a tick. The key is you don't want to heat them. You don't want to alcohol them. You want to either use a forceps and pull them straight out, or my favorite is like these little tick removal hooks. You just kind of put the opening through the head of, like around the head of the tick, and you just kind of rotate and pull at the same time. And that seems to be a really easy way, not very awkward, to get these ticks off, and they're like $4. So for me, like that's what we have at our vet hospital to help remove ticks. And if we're catching them soon, we can get them before they're engorged and before they can transmit disease. And anytime you're removing a tick, you just want to use proper hygiene. If you were to squish a tick or get contaminated, there would be a risk to you. So always make sure you're, using gloves or hand washing after, and trying to minimize, trauma to the tick is going to minimize your trauma as well. And I think before we start, we can talk about the signs of tick-borne diseases in dogs, because it is interesting. It's a little bit different than the signs in humans. And so I think that's important to remember. In humans, we always think about that bullseye lesion, which is, scientific name is erythema migrans. But we rarely ever see that in dogs. In dogs, we see, limping, we see painful, swollen, hot joints. We'll see maybe that they're just not acting right. They've got a fever. They've got enlarged lymph nodes. They may have bruising, little pinpoint bruises called petechiation, and they may just not be acting well. So the signs can be relatively vague. And so when you're looking for those signs, you say, okay, I have these vague signs, coupled with, if you're in an environment where the risk is higher, or you've seen ticks on your animal in the previous 3 to 6 weeks, that would all be information that you'd want to say, okay, it's time to go to my veterinarian, and I'd want to let them know that I have had exposure, or my dog has had exposure to ticks, and see if we need to be tested. So I think at this point, I have a few more slides, but what I'd like to do is just kind of see what kind of questions we have. I know that Alyssa had some questions as well to kind of help direct the next parts of this discussion.
Sure, Amy, that's a great start up for us to give us some good background information about what ticks are out there, where they might be living, how they attach to our dog. I've seen ticks doing that questing behavior, and it's really a little bit creepy, but they are extremely tiny up where we live near Brule. And you mentioned that nymph stage, and I just wanted to ask you, are the tiny ticks at that size still able to be infected with the bacteria, or is it just the adult ticks that have a infection?
Yeah, I think that's a really great question. And so I pulled up, this is the life cycle of a tick. So of an ixodes scapularis tick. And so most ticks have multiple life cycles, and they can't transmit Lyme disease from like mom to baby in the tick world, right? But they have to be exposed to it. But they're exposed to it usually when they're hatched into larvae over here. And so you can see here that in this nymphal stage, they actually become infective. So yes, at the nymphal stage, at that second to smallest size, they can be infected. Not to say they have to be, but they can have and harbor borreliosis, which is the targeted agent of Lyme. So if we come back here, so right at this stage, they can be infected.
It's pretty incredible because I've seen photographs of a poppy seed muffin, and I think it came from the CDC, and they've put 5 tiny nymphs on a top of a poppy seed muffin, and you can barely find the 5 ticks. So
Yeah.
I want to just emphasize your message that these tiniest, hard to see ticks can also carry disease. So we really have to look when we're doing a tick check. And maybe
Yeah.
we could talk about that tick check. Is there a good way to do that, or are there little secret places that these ticks like to climb into that we might be missing when we're checking our pets?
Yeah, so any kind of warm, humid environment is where a tick likes to be. So eyelids, ears, like so inside the ear, I would look in there. The gum line, under the collar tends to be a common place where we miss because they have dogs wear their collar all the time, or a lot of times they do. And so checking under the collar can be a nice hiding place. The genital area. So my personal dog got a tick on her vulva. So always checking in those kind of more private areas can be important as well.
Oh, well, thank you for saying that. I never thought to check his gums, but that makes sense that that would be the warm, moist area that you say that they prefer.
Yeah.
I wanted to welcome folks to either type their own questions into the text or the chat box, or feel free to raise your hand using the button at the bottom of your screen, and I'm happy to call on you and unmute you. Um, Linda says in the chat that Lone Star ticks can cause people to develop an allergy to red meat. Is that the same thing for pets as well?
That has not been, I would say that we don't know. I don't know that that's been specifically studied or targeted, but in general, allergies to red meat are incredibly uncommon in dogs. So not that I'm aware of. Not that I'm
Okay,
aware of.
okay. And let's go back to some of these preventative strategies things that we can do to prevent the animal from coming into the house with any tick on it. Um, there's a manual extraction, it sounds like, and then also sort of a chemical barrier. So we need to be on the lookout for ticks every month of the year, as you said. I've heard of horses being infected in February. So even though there's a lot of snow in the ground, from what you've said to us, it sounds like we should really be giving a once over throughout the whole year.
Yeah. So certainly, what we talked about in terms of prevention was largely like manual removal, but we should certainly talk about other options that we have for prevention as well. And we do recommend year-round prevention. So year-round screening for ticks, especially if they have a high exposure, they're going through that high brush and have easy access to that. We also recommend year-round flea tick prevention. And typically what that entails is some form of topical or oral preventative measure that you give once a month or once every 3 months, depending on the product, to help prevent the tick infections. And so how an oral would work is that the tick has to bite to get the medication, which then kills the tick. But it works so quickly. Whenever a tick bites, in order to transmit Lyme disease, it has to be attached for about 24 to 48 hours before it can transmit the disease. And so it kills it before it can do that. There are other products like the topicals that contain permethrins that will actually repel ticks. So it will repel ticks, and if a tick were to bite through that repellent, it would kill the tick as well. The downside of those is it's topical. So if you have a cat in the house, cats, permethrins are toxic to cats. So if your cat's doing any grooming of dogs, that can be a problem. But also if you're bathing your dog a lot or they're swimming a lot, we may lose some efficacy in that way. And then there's also collars. So the Seresto collar has
Oh,
really good efficacy and lasts for about 9 months. It just has to have really good skin contact. Sometimes we leave it a little too loose and then it can't do its job.
yeah, that's really an important thing to know. I'm kind of in a mini discussion with my partner about vaccines and these chemical barriers. Is it safe to have a vaccine and give them these monthly or treatments, either a chewy tablet or the topical that you described? Is it safe to
Yeah.
do both?
It absolutely is safe to do both. The only vaccine that we have to help combat tick-borne diseases is for Lyme. So there's a Lyme vaccine available, but there's no Anaplasma or Ehrlichia vaccine. And largely, we tell clients that they the number one thing you can do to prevent Lyme disease is to have your dog on year-round prevention for flea and ticks. So some form of flea and tick prevention. The vaccine can be used in addition in endemic areas to help reduce the risk, but we know that the vaccine is similar to any other vaccine is not 100% protective. The best way is to kill the tick before it can transmit the disease. Um, there can be side effects of the vaccine, although very rare. And so we usually use the vaccine as an addition in animals that are endemic areas to help provide additional support. But the number one thing that we can do is beyond year-round flea tick prevention.
Fascinating. And then I heard from a vet on the radio that even though you have the vaccine and you're using the monthly chemical barriers, you should still get your pet tested once a year for tick-borne illnesses. You're shaking your head. Do you agree with
Yeah, yeah. So again, like all of this is contingent on where you live, right? But if you live in an area that has a high prevalence, 6% for Ashland County of Lyme disease, we certainly would recommend every year testing. And the reason we do that is that a lot of animals are asymptomatic. A lot of animals are asymptomatic for these diseases. And so for Lyme disease, that may not be a big deal. But for other diseases, they can harbor it and then they can become very, very sick. And so if we can catch it early and screen for
Mm.
some of those things that can make them very, very sick, we can treat it really well and we can treat it very effectively. And then that can also, if they have Lyme disease, allow us to look for things that we won't necessarily look for to make sure that we're not seeing some of the more serious sequelae of Lyme disease. So in our area in Dane County, we have a lower prevalence. So sometimes if they're on year-round support, we'll say, okay, we can do every 2 years. If they're not on year-round support, every year we're testing. And if they're in a high prevalence area around Wisconsin, every year we're testing to make sure that they haven't developed one of the tick-borne diseases or heartworm.
So that's just a really excellent, thorough, comprehensive check way to make sure that you're preventing as well as you can and then checking to see that you've caught everything.
Exactly.
Good care. Linda says that her dogs get the Lyme vaccine. I had one dog that tested positive for Lyme, even though she was vaccinated. Does the vaccine generally have good efficacy throughout the year, or does it wane before the next 1 year booster?
That's a great and loaded question, Linda. So yes, the vaccine is effective. It's not 100%. So I'm not surprised that unfortunately your dog tested positive for Lyme. And it's important to remember that the Lyme test is an antibody test. So it tests for exposure. So it doesn't tell us that they're infected. It tells us that they were exposed to Lyme. So I think that's a important delineator. So even if they're positive, they're going to be positive for a long time, sometimes forever, and that doesn't mean that they are still sick or that they ever were sick. Um, in general, we know that the vaccine in most cases lasts for about a year, but in some studies, they found that depending on the individual immune response, it may not be as effective at certain time frames. So in one study, some dogs became sick 22 weeks into their booster. And so there's a lot of debate on whether or not the Lyme vaccine should be boosted at 6 months again, or given yearly, or the consistency. And it probably, honestly, similar to humans, has to do with the individual's response to that vaccine. But we don't have good titers or anything like that for Lyme where we could check and say, okay, your titer shows that you are protected. So it is better than nothing in a highly endemic area. Like, I think it's something that can be considered, but we certainly shouldn't hang our hat on it, right? We should use our other preventative measures that we know are effective, that we know really help reduce the burden. And that has been proven in many, many studies to help reduce the risk, and then use the vaccine as an additive to that.
Sure, that makes total sense. There's a question from Keslin about how effective is NexGard is in preventing ticks. That must be a brand name.
Yeah, it's a brand name. And the main ingredient in NexGard, the broad category of that is an isoxazolane. And that's the main ingredient or type of drug in NexGard, Simparica, Credelio, Bravecto. And all of those have been shown to be very effective at preventing tick-borne transmissions. So again, they have to bite, so it doesn't prevent them from getting ticks, but it will prevent tick-borne diseases. And they work very quickly. So within about 4 hours, they're killing those ticks, 4 to 8 hours.
That's amazing. Wayne's got some questions about natural remedies. Have you heard of any natural remedies that prevent ticks illnesses? Illnesses?
Yeah. So there's been a lot of proposed natural remedies, and I think that I've seen them all in terms of diatomaceous earth and essential oils and things like that. And most of them don't seem to be very effective. I see a lot of animals that come in with some of these natural remedies, and they still have fleas or they still have ticks. Um, some of them can be harmful. So that's, I think, you know um, where we need to focus our understanding is a lot of people will use things that we understand are tick preventatives, like essential oils like cinnamon oil or clove oil. And when you look at the ASPCA poison control, one of the most common reasons that people call in with toxicities is because of essential oil exposure for dogs and cats. And what happens is that we apply it topically and the animal either licks it off or it's absorbed through their skin, and it can cause really bad effects ranging from vomiting, lethargy, drooling, tremors, things like that. And so a lot of times we rely on these more natural methods because we feel like they're safer. But these are still medications. And so we need to be aware of the side effects of those. And especially in cats, they're really, really sensitive to certain triggers like that. And just be aware of that if we're using something that's natural.
I've heard of putting brewer's yeast on dogs' food because somehow it makes them less palatable to all kinds of bugs, mosquitoes, fleas, ticks. I don't know if that's at all true, but brewer's yeast is a like a B vitamin in a powdered form that may or may
Yeah,
not work. Could be a
right. I mean,
wives' tale. I don't know what
yeah,
you've
I
heard.
know. I think that's one of them. Like, I think all of us are open to the idea of some kind of, natural additive being helpful at reducing the risk of contracting certain diseases. But just like in us, there's a lot of people that are getting brewer's yeast as a supplement, and we still get tick bites,
Mm.
So I don't think if it does work, it's not at the level of saying like this is going to eliminate it. I was mentioning to Lisa before this that they did some like abbreviated studies looking at like turmeric oil and orange oil, and found that like turmeric oil maybe reduced the risk of tick attachment, but again, significance that wasn't really found. And in orange oil, there was no difference in tick attachment. So we can use these as like additives, but first we need to make sure they're not toxic, because a lot of these nutraceuticals and natural ingredients can actually hurt our animals. And then we need to make sure, like, is it working? And so if you try something like that, if you try brewer's yeast, if you try diatomaceous earth and you're seeing ticks, say, oh, okay, like I probably need to try something different. And now I need to make sure that my dog is tested because they haven't been on a known preventative.
And that might be true for Wayne's question about spraying a pet with garlic or feeding garlic to a pet. Not
Yeah,
enough research on that yet?
definitely not enough research, but we do know that actually garlic, like orally, is toxic to cats and dogs. So
Oh,
garlic and onions are toxic, and so we would try to avoid any of those in our food for those animals.
oh, that's interesting. Linda wonders if you can spray off on your pets or
You
anything
cannot.
with DEET.
Great
How about
question.
DEET?
Nope, nope. Good question. Those should be avoided for dogs and cats for sure. So they can be toxic. So yeah, so any of that kind of spray that we use on us, we would not use on animals. Certainly, one of the things that we use for us would be like permethrin soaked clothing to help prevent tick bites. And we use permethrin in some of our topical preventatives for dogs and cats. So that would be okay. But but those are veterinary approved products at a dose that we understand. versus kind of off or deep, where these animals, I mean, they lick themselves. You can't stop
Mhm.
them from doing that. And that could be very toxic to them.
Yeah, that's a great point. It's so easy to think, well, something works on us, our family members, our kids, so it's okay for the dog. But I can see where those things could be really toxic,
Yeah.
especially in doses that we might use on ourselves. Spray your arms and legs could really hurt an animal.
Right. And we forget, like for us, we don't groom ourselves, we don't ingest what we apply topically. And for animals, we have to take that into account when we're looking at a topical, is that they may ingest that, and how will that interact?
So I'm wondering, this might be beyond just a vet question, but we have vaccines for our pets. Have you heard of any similar kind of prevention for humans? Was there ever a vaccine for a tick-borne illness for
I,
humans?
I think there was, and this is a little bit out of my realm. So I would definitely take that with a grain of salt. But I think there was a Lyme vaccine for humans that got taken off of the market um, several years ago, and I'm not sure why or but I believe that there was, and I do believe that they're looking at future vaccines for Lyme disease, and on the human side as well. But I'm not sure where they're coming with that. In terms of oral preventions or like topical preventions, um, there's nothing out there that's similar to what we use for dogs, and part of that is a lot of our research has been in topicals, and obviously we bathe a lot more than even the most bathed dog bathes, and so topicals become very difficult at because we wash them off. But we do use like the permethrin soaked clothing, the topicals like DEET, that for humans, that can be helpful at preventing the transmission of tick bites.
Okay. And I imagine we can't give our pets certain things that we take as humans. Humans should not take the pet's preventive
Correct,
tablet.
correct,
That's a
correct.
given, right?
That is a given, yes. And yeah, someday maybe there will be some kind of prevention for humans similar to what we have in dogs. But right now, there's no studies showing safety or efficacy of the oral tablets that we give for dogs being used in humans. So we would definitely not encourage that.
Okay. Well, let's talk about some of the symptoms that we might look. You showed a slide of some of the things. I know I had a dog previously who had a tick-borne illness, and the symptoms were so subtle that really all we could tell was that she was kind of lackadaisical and not eating that much. So, can you go through some of those symptoms again and like when we should
Yeah.
really get in to see our vet and have a test?
Yeah, and that's the frustrating part, Lisa, is that the signs, like either sometimes there's no signs, right? You just happen to do your routine screening and you're like, oh, my dog has anaplasma, and they can have blood derangements because of it, and they won't show signs because dogs are amazing. But some of the signs that we may expect to see is exactly what you're describing, is that they're just not themselves. They're a little bit lethargic, maybe they're a little stiff. If you check the temperature, they may be febrile or have a fever, but the signs can be quite vague. Typically, like the typical signs that we often see with especially Lyme disease is going to be a shifting leg lameness. So they'll be lame on their right front, and then they're kind of limping on their left back. And you're like, what's going on here? And you're like, oh, maybe they injured it, but then it's a different leg the next day. And that's very typical of a tick-borne disease. So if you saw that, that would be a hallmark to say, hey, vet, this is what I'm seeing. Should we be testing for something? But otherwise, the signs can be very vague, and so that's where it's really important to come into your vet and indicate exposure, especially if your vet isn't in a highly endemic area, but you travel to highly endemic areas. It's really important to let your vet know, hey, I go up to Ashland, I go up to northern Wisconsin, or I travel around state to areas where this is higher prevalence. I'm not on year-round prevention. Like, should we be screening for this?
Mhm.
And so that can be really helpful as you're building a relationship and a team with your vet to just kind of make sure everyone's on the same page with exposure risk.
And I think that's a really important point that up in the northern part of Wisconsin, we might be pretty familiar with tick-borne illnesses, and our vets are probably familiar, but visitors who come here and then go back to their own state might not be as familiar. And this could be pretty perplexing for a veterinarian to see these sort of um, mild symptoms and not know what to even look for.
Absolutely. You know, I came from, as you mentioned, California, and we don't have Lyme disease there. And so it was really important if we had a case, that came from New Jersey or something like that, we'd have to say, okay, maybe we need to be screening for this because they have a higher exposure where they were. Um, and it's the same thing wherever you're traveling, whatever state may have a different prevalence of different diseases. So you just want to make sure that if you're doing any traveling with your pet, that you're letting your vet know where you're traveling.
And I assume that once a pet is infected and treated and seems to be back to normal, they can still be reinfected again, either with the same disease or a completely different one. That's true?
Yeah, it is true. Unfortunately, there's no protective immunity after they get, especially for Lyme disease. There's no protective immunity for Lyme, and part of it is how the organism works and how it shields itself and keeps itself protected from the environment.
Mm.
And that's part of the reason. In going back to that question about vaccines, um, there's no learned immunity, and so that's why they need to keep getting their boosters every year. And that's why if they have become Lyme positive, even if they still have antibodies, they can still become re-Lyme infected. And so even if they have had Lyme disease, they still need to be on their preventions. You could still consider, if they're healthy and they don't have some of the complications of Lyme disease, you could still consider vaccinating them.
So once a pet is found to be positive for one of these infections, what kind of treatments can we expect our vet might prescribe for our dogs or cats?
Yeah, so it really varies. What I would say is that the first question that any vet has to ask is are we finding that your dog was or cat was exposed, or do we think that your dog or cat was infected? And so if they were just exposed to Lyme disease and we screen them for some of the diseases and complications that come with Lyme disease, and those are normal, we may do nothing. We may do nothing and say your dog was exposed, but that doesn't look like they were infected, that they got through scot-free. If there were signs of infection, such as, we did a urine test and there was protein loss in the urine, or you were anaplasma positive and we ran a blood screening that showed that there were organisms or there were derangements in our protective immunity or our white blood cells, then we would recommend doing a course of antibiotics. And those antibiotics, just like any antibiotic, as soon as I say antibiotics in humans, we think, oh, GI upset and vomiting and diarrhea. And that can happen, but it's pretty uncommon. We give it with food and it tends to be well tolerated. And we do the antibiotics for a specific period of time, depending on which tick-borne disease we are worried about and them being infected with. And usually they respond really well.
Mm, that's fascinating. I know for humans, it's recommended if you're on antibiotics that you take some yogurt or some probiotics. Is that similar with the dog to alleviate some of the side effects?
Yeah. So in general, we try to steer away from yogurt just because they have a different population of bacteria than we do, and a lot of dogs are actually lactose intolerant. And so sometimes that alone can cause some GI upset. So then you're like, is it the yogurt or is it the antibiotic? But certainly, we do encourage people to start their animals on a probiotic. And there's a lot of veterinary probiotics that are available, and usually we'll recommend a veterinary approved one just because, similar to the human side, in products that are not FDA regulated, we don't know what's actually in them, if it's the bacteria they say, if it's at the population they say. And so having a product that has some internal source control is helpful for that. But yes, that can absolutely help kind of keep the good bacteria present and populated while we're using an antibiotic.
That's great to know. And how long does it take for pets to recover?
So usually it's pretty quickly. So depending, and again, it depends on, in some cases, the body kind of responds to the infection and has like an over dramatic response, and you get kind of an immune reaction. And that can be a little bit harder to treat and a little bit longer course of treatment. But if you have just an antibiotic response of tick-borne disease, usually they're going to be feeling better in a few days. And then we kind of have a longer course, usually 14 to 28 days, depending of antibiotics to kind of keep them supported.
So at that point, it's really important to keep taking the antibiotic, even though your pet looks better, feels better, eating again, but still you need to have that full course to actually kill the full infection.
Absolutely. And then if your dog, had a secondary immune reaction to that infection, then that's a different ordeal in terms of the treatment that we would recommend and the follow-up that would be needed. But for your typical, you know, just the Lyme disease, your body didn't overreact to it, that's what we'd be looking at.
Okay. Feel free to keep putting your questions and comments in the chat or raise your hand and we'll unmute you. Sarah says that her dog tested positive for anaplasma, and every year since, the vet recommends that they do a blood test and the blood to see if the blood disease hasn't affected his blood cell count. The vet
Mhm.
also wants to give him antibiotics for it every year, even though the pet shows no symptoms. So, should Sarah really get the blood tested and antibiotics given every year as sort of prevention, it sounds like?
That's a hard one. It's really hard kind of coming into a case and not being able to see the full picture. Um, so I guess I would say, I would trust your vet if they're saying that, I think that, or at least have a conversation, say like, why are we doing this every year? In general, we will absolutely screen animals if they are still anaplasma positive and say, okay, let's make sure, because again, if you're testing for exposure, we don't know if they're reinfected or if they're still just having residual exposure. And so by using those more confirmatory blood tests, we can tell more about whether or not this animal is showing signs of infection versus re-exposure versus reinfection. That got confusing. So that can help us really decide that. Same thing with Lyme disease. We will usually, if an animal's Lyme positive, even every 6 months, say we should be checking your urine and making sure that
Mm.
we're not seeing signs of kidney damage through your urine, even if they've never been showing signs of sickness before, because it can develop either because of the immune response to it over time. We think of in humans with chronic issues with Lyme disease that can build up over time, or because, again, we don't have protective immunity. And so, can we have been reinfected with anaplasma and now we're showing some blood derangements because of that we caught early, and so we were able to treat with antibiotics. So it's super case dependent, and the frustrating thing is really delineating between infection, reinfection, re-exposure.
This is where veterinary science becomes sort of veterinary art too. You're
Yeah.
balancing, your intuition and the dog's history. It's not just dealing with one illness. You're really looking at the whole picture of that pet's life cycle, so to speak.
Yeah, exactly. And you're weighing the pros and cons, right? What is the con of missing something and having your dog get really, really sick versus what is the benefit of early routine screening? And so that's always the dance that we're making with our clients is what is your exposure risk? What is your dog's risk? How do we balance that?
Well, and Sarah follows up by saying her vet says it's up to her every year on how to treat that dog with tests and antibiotics, and that it sounds like if the blood test comes back okay, there may not be a need for antibiotic therapy.
Yeah, I think that, if the blood test comes back okay, we know that that's the main way that we have clinical signs of anaplasma. And so if we're not showing signs of active infection, then I think it's fair to continue monitoring for those signs. But otherwise, you may not need to treat unless you developed those signs.
And I imagine in terrible cases where pets aren't, their illness isn't addressed in time, that they can actually die from a tick-borne
Mhm.
illness.
Mhm. Absolutely. Especially, Lyme, we think of all the chronic stuff, right? And we think of all the immune mediated and all of the, like in humans, Lyme nephritis or kidney infections associated with Lyme disease. Anaplasma more directly affects the white blood cell count. And so it can make you unable to fight infections. It can make you more likely to bleed. It can make you anemic. And so those side effects can be much more serious. And again, if you're screening for it and looking for it, you can easily treat it. It's probably easier to treat than Lyme disease in terms of the lack of the chronic manifestations that we associate with Lyme disease. But you need to be looking for it.
Get it in time.
Yeah.
Linda asks, are older or younger dogs more susceptible to disease symptoms actually developing, or does age or health not play into that?
The only way, so that's a great question, and I think the nuances are unstudied. So, but would be something that would be that would play a role would be the activity level of those dogs. So if you're seeing like a 13-year-old, a 15-year-old dog, they probably aren't going out hunting. They probably aren't going out and exposing themselves the same way that a 2-year-old Labrador is going to be out doing things that and getting into high brush and having more tick exposure than an older dog. So in that sense, the exposure risk is going to be heightened. Certainly when they're really young, they're still building up their immune response. And in terms of response to vaccines and in terms of response to infection, that may be a little bit skewed, a little bit delayed. But otherwise, there should be no real difference in terms of how these animals contract the disease besides their exposure risk.
That's good to know. We've got about 10 more minutes left, so I encourage you to keep putting questions in the chat or let me know and I will unmute you. I wanted to take another question from Sarah that she has read that Anaplasma can go away on its own. Is that true? And do you know how long you could expect a dog to carry the disease if he were not reinfected in the future?
That's the $1 million question, because we screen every year and they'll be positive and then suddenly they're not. They're not positive anymore. They become negative. And that can vary. It can be 5 years, it can be 7 years, it can be 2 years, it can be never. And that's the difference between having an animal that still has antibodies against a disease. They probably still don't have anaplasma. We just don't know because we can't test for it. But they still have antibodies to it, so they're still testing positive on the test. At some point, a lot of these dogs will become antibody negative, but we just can't predict when that will happen or if it will happen.
And I wanted to ask you, there's a tick app, and I'm going to put a link to it in the chat box that we can download free on our phones that help researchers figure out where exactly people are getting infected. Does the tick app also work for our pets in terms of reporting to this big statewide database about what's getting infected where?
Yeah, I think that there is a dog section on that app, and it also is helpful at kind of figuring out how do I take off a tick from a dog, some of those basics that we covered, but I think it has some of that information as well. And it helps. We know that unfortunately, humans are more likely to be exposed to tick-borne diseases when they're having dogs that are exposed to tick-borne diseases. And it's not because the dog is infectious to the human, right? And it's not because the tick that attached to the dog is infectious to the human. Like, it's not like zoonotic in that way. It's not like, but it's because you're exposed to the same population of ticks. So if your dog has a higher prevalence, they're bringing in ticks on them, you're going to have a higher prevalence because you're exposed to those ticks. So the tick app can help you kind of keep track of the area and say, okay, I'm exposed to this tick. My dog was exposed, and kind of what to keep an eye on. And so I think that's really valuable, and it provides really valuable data. I think that the tick app is looking at like University of Wisconsin, Illinois, is it Minnesota?
I think
And
there's a section in Minnesota also. Yeah.
yeah. And so you're getting kind of a community of people all taking part in this and saying, okay, I found this tick on my dog, let me report it. I found this tick on me, let me report it. And so we're getting a really more centralized idea of the tick burden in our areas. So I think if you're willing to do it, they have like a little tick diary area you can fill out. I think it's a really great way to participate in making sure that we are as knowledgeable at knowing what's going on in our environment as possible, because only then can we really know how best to prevent it.
That's an excellent point. And really it expands the reach of the researchers who are looking at this, because there's so many of our eyes out in the field
Yes,
in our backyards, and we're seeing all this and we're sending that information into the researchers who can draw better conclusions about where these ticks are and what they're doing. And that
exactly.
makes me wonder if there's a place that veterinarians have to record infections anywhere to a state database or anything like that.
It depends on the infection, but for these common tick-borne diseases, there's not. So when we look at the website that checks prevalence, that's directed from a laboratory that takes in a lot of our testing, and so they're able to provide that information to get like a global assessment of risk for our dogs, but we're not required to report it to like a public health lab.
Okay. And I had one other question too. Are there any resources that you recommend for us as pet caretakers that we might go to for more information? I did put a link into the School of Veterinary Medicine that you've got a lot of resources on your website, but are there any other things that you might recommend for us?
Yeah, I think that's a great resource. The other resource that I kind of put in, and I can see if I can share my screen. I think it's super fun. That also is probably the nerd in me. But I go to the CAPC website all the time, and I will often go, like if I have a client that's plotting a trip, they're going, I'm going to North Carolina, and then I'm going down, and we'll just like track the counties that they're going to and look at prevalence of diseases. Let me see if I can show this, but I think it's really fun. And I think it also can kind of give you, if you're looking at, you're talking about, okay, do I need to test every year? Do I need to treat every year? Do I need to prevent every year? This gives you some more kind of knowledge to help you decide that. It helps you fuel the veterinary art, right?
Mhm.
We can say, okay, we know this isn't art, but let's try to make it as data driven as we can. So let me go to share screen. Okay, and are you seeing the CAPC website?
Yes, big, beautiful map. Mhm.
Perfect, yes. And so you can see globally, right? If you're traveling to Texas, you can look at different prevalences, but it also tells you heartworm, intestinal parasites, tick-borne diseases, viral diseases for cat and dog. And so I can say, okay, I want to look at tick-borne diseases, and you can look at Lyme, Anaplasma, or Ehrlichia. And then you can kind of go by map. So you can say, okay, if I'm in Wisconsin, where are my risks, depending on county? If I want to look at, oh no, let's see. Oh, it has like a nice forecasted prevalence of Lyme disease, which is probably very applicable to this talk. So you can
Yes.
look at the forecast of where they think, because the other thing is depending on climate, right? We see ticks move and become active in different areas at different levels. And so looking at that can be very helpful too. And I think that's where that tick app that Lisa put in the app in the chat can be really helpful as well. But you can go through and say, okay, what is my true risk factor for each of these diseases? And right now my computer is freezing, but I think that's really helpful, right?
Yeah.
You can look at like all the preventative plan for this.
That's a really great idea. And did we put that link to that website earlier?
I
The
think so, but I can put it back in just in case, since I know that the chat has been going.
Perfect. And I will put in these links into a follow-up message in an email that I'll send to everybody after the event. But I don't know if people know this. If you want to save the chat contents on your own computer, you open your chat box and go to the very bottom where you could start a new message. And you'll see a little smiley face all the way to the right. And then you'll see 3 horizontal dots. And if you click on those horizontal dots, you can see the word Save Chat. And just click on Save Chat, and now you've got all those resources saved on your own computer. So it's a nice little tip when you're watching a webinar and you find some great stuff you want to learn more about. We've got a few more questions before we end. I use a topical tick medication on my dog and he swims almost daily in the summer. Do you think applications every 28 days is sufficient to cover him?
Yeah, that's a great question. And it depends. I don't know, Sarah, if you mind kind of providing what kind of topical tick medication you use. Some of them are water resistant, and some say that they're waterproof. But we do know that even with the water resistant, if they're swimming a lot, that can reduce the efficacy. Canine Advantix too. Perfect. And that one's a nice one because it's got a permethrin in it too, so it's got repellent characteristics, which is nice. You just want to make sure no cat is grooming them. Having worked ER for several years, that's like I'm like, don't get the cats, don't create toxicity for cats. But you may see a loss of efficacy. You may, if he's bathing or if he's swimming that frequently. So if you're starting to notice that ticks are attaching, remembering that the Advantix should be a repellent and a killer. So if you're seeing them attaching, then that would be a sign to me that the Advantix is not doing its job. And you could even consider giving it more frequently, or seeing, do I need to combine it with something different? So your vet can help you make that decision if you go with more frequent or if you add a different medication. But if you're seeing good effect, then it may still be effective because it should be water resistant, but you're putting it through a pretty heavy load if he's swimming every day.
Yeah, just like us in sunscreen, I imagine you
Yes.
just reduce the overall efficacy.
Yeah, and it's absorbed into the bloodstream through the follicles. But even then, because it is a depot, it lasts a long time. The frequent bathing can affect the results.
Okay, thanks. Question about whether we should wear tick collars around ankles.
I don't have a clear answer, but I would hedge towards not, because we just don't know how these are going to work on humans. The studies haven't been done. And if we extrapolate from one species, like a dog to a cat or a cat to a dog, like that's my world. So that's what I can speak to. We know that there can be toxicity across species. Even if something's really safe for a dog, it can be very harmful to a cat. And so I would stick with what we know in terms of topical preventions for humans, and not try to risk it.
Okay, thanks. We've just got about 2 minutes left. I put a link to a short anonymous evaluation about the program in the chat, and we're asking you mainly, what did you learn today and what else would you like to learn? So I encourage everybody to give some feedback, so it helps me plan more programs in the future. Let's do one more question, Amy. I'm
Yeah.
constantly weighing topical versus oral applications. I like that the topical repels as well as kills. It sounds like most vets say oral tick prevention is more effective overall. What do you think?
Yeah, I mean, really, again, great question. The orals do seem to be more effective, especially in terms of kill time. So they're just so much faster. If you're looking at, I know you're on Advantix, but when you're looking at some of the like fipronil derivatives, it can take 12 hours to 24 hours to kill a tick. And so while that should be fine for Lyme disease, anaplasma can transmit more quickly. And so are we proposing or putting them at risk if we have a slow kill time on a tick? So that would be a concern. And like honestly, sometimes what I've done and it depends again on the case, and a case by case basis, but sometimes I'll even alternate. So I'll have them on a repellent and an oral, and I'll switch off every couple of weeks. And in California, where we had really resistant flea issues, that's kind of how we would manage it so that we could get the tick properties and get a really good flea product, since some of the topicals in California don't work because of the flea issues. So it's hard because I agree. I love the idea of repelling ticks. Like, why would you want them in your environment? Why would you even want them to have a chance to attach? I can definitely see the appeal of that. It just becomes concerning if they're not as effective. And in some cases, if we're putting them through the ringer in terms of bathing, or swimming so frequently, if we have a fipronil based product that has a slower kill time, we're making it harder for the drug to do its job.
Well, this has been so informative, Dr. Amy Nicholson. I really appreciate you being here. The main takeaways I'm hearing are to minimize your exposure in habitats where we have learned ticks are more prevalent, check them as often and as carefully as we can, provide some chemical barriers to their to infections taking hold by either putting topicals or vaccines or monthly medications, and be alert to your pet's overall demeanor and health so that if they do start to act a little bit unusual, you can detect it earlier, get your pet to a vet, and let he or she take over with the diagnosis and a treatment.
Yeah, for me, I think that's a perfect summary, Alyssa. And for me, I think if I wanted you guys to get one thing out of this, it's stay on a preventative year round if you can. It's just so important. That's the number one thing you can do to prevent tick-borne diseases. Check your pets daily, especially if they're in a high risk environment, and communicate that risk with your vet. So if you're noticing those odd signs, just, it's so hard sometimes for us to know all the nuance of what your dog is doing in its everyday life. So having you come in and say, oh, he's doing a lot of swimming every day. Oh, he's traveling to Louisiana twice a year. All of that can be so informative to help us target a plan for you and your pet.
Well, this has been fantastic. I know I've learned a lot. I appreciate you being here. Good luck with all your teaching and your practice this summer. And thanks to everybody else for joining us. It was great to have you along and have so many wonderful questions.
Yes, thank you so much for all the participation.
Sure. Well, take care, be safe out there, and do every prevention you can.
Take care, everybody.
All right. Bye bye.